to my channel. Thank you very much for your time today. Today I'm here to talk about who a biomedical scientist is. I have started a series of video to talk about what biomedical science is and who a biomedical scientist is and every other thing in relation to biomedical science. So this is the second part. If you've not had a look at the first part, kindly have a look at it. It's about what biomedical science is about, the entry requirement, the different kind of routes to get into biomedical sciences. So I'm going to progress now to the second part, which is who is a biomedical scientist. So a biomedical scientist is a scientist that has been trained in the field of human biology in relation to medicine. This scientist has gained adequate knowledge and understanding about the physiology of the human body, how it works in a normal state and also how it works in a disease state. So what do biomedical scientists do? They apply the scientific knowledge that has been gained through their degree to carry out some laboratory tests and to carry out some scientific procedures that would help to generate some information or give details into several pathological conditions. This information are quite useful in the diagnosis of diseases, in the treatment of these diseases, management of these diseases, and also the treatment for these patients. So the biomedical scientists apply the theoretical knowledge that they've gained and the practical knowledge that they've gained to carry out laboratory procedures to gather information in a means to help the diagnosis and treatments of diseases. So when you go to the GP, or if you have a condition and you need to see your GP, or you need to see a doctor, they would probably take a blood sample or a urine sample, or they might take a piece of tissue like from the skin if it's for a skin condition, and they send it to the laboratory to find out what is going on, to be able to diagnose the disease or whatever the problem might be. This is where the biomedical scientists come in. They receive these specimens and they carry out several procedures on this specimen, from which they'll be able to assist the doctor in the diagnosis of any diseases. So after the diagnosis of these diseases, they also play a huge role in the treatment and the monitoring of these diseases, because the information they gather from these laboratory tests would give them an idea of what the condition is, what sort of medication he might respond to, and also to monitor if the patient is responding to the treatment by taking more samples and evaluating it. And if the patient is not responding, they can change the drug or the medication or the dosage so that the best treatment plan is being put in place for the patient. Biomedical scientists, I would say, play a huge role in the field of medicine, because the result they obtain from the tests they carry out are what the doctors use in the diagnosis of the diseases and the treatment of their patients. This ranges from any specialty in medicine like dermatology in case of a skin disease or skin cancer, to accident and emergency where if there's a need for blood transfusion, the biomedical scientists will play a huge role in testing the blood of the recipient and the donor to make sure it is compatible, and also to cancer in surgery when the patient are being operated on. The biomedical scientists can be able to carry out some tests to make sure that the whole cancer has been removed, and if there's anything left, the surgeons can go in and take more. So it's a very, very important role in the diagnosis and treatment and management of diseases. Outside the role they play in the diagnosis and treatment of diseases, biomedical scientists also play a role in genetic counseling, where they carry out genetic studies. From these genetic studies, they are able to provide adequate information for parents about the risk the child or the unborn child might carry. A good example is sickle cell anemia. Biomedical scientists can carry out genetic testing to test the parents if they are carriers for these traits. So if they are carriers, there's a 25% chance that their child can suffer from these diseases. So it's quite useful for the parents to know and make adequate plans, or make best decision in regard to having children. Also, biomedical scientists carry out researches in drug development or into cancer or into various diseases. They also help to provide information into adequate drugs to use and also in the treatment and management of diseases as a whole. So a biomedical scientist can specialize in various fields in the laboratory. They could specialize in blood sciences, cellular sciences, infection science, and virology. Thank you very much for your time. If you've not subscribed to my channel, kindly do so, like and share this video, and I'll see you in the next video.